Hi, I'm Katie Moran-McCabe. I'm a lead law and policy analyst with the Center for Public Health Law Research at Temple University's Beasley School of Law. Today, I'll be sharing some results from a paper that my co-authors and I wrote that was recently published in the American Journal of Public Health. The paper is entitled Trends in U.S. State Public Health Emergency Laws 2021 to 2022. And my co-authors were Elizabeth Platt, Amy Cook, and Scott Burris, who are also with the Center for Public Health Law Research at Temple. I'm going to talk briefly about the research reported in our paper, first saying a few words about the methods, then I'll highlight some of the results and conclusions. The work I'll be talking about today is part of the Act for Public Health initiative, which is a collaboration among the organizations shown on the left here. So as part of that initiative, our center, along with the Association of State and Territorial Health Officials, the Network for Public Health Law, and the Local Solutions Support Center, we're working together to track legislation addressing public health authority and to create resources to easily see the legal landscape on this issue across the United States and how it's changing. This gives you a high-level overview of our legislative tracking process. ASTO and the Network for Public Health Law provided us with the bills that their organizations were tracking using either a commercial bill tracking firm or reviewing state legislative websites and media reports. And then our team at the center merged those bills as needed and organized them to be input into Monocle, which is a policy tracking software, where a record was created for each entry in the spreadsheet. We then added the text of the bills to the records in Monocle and added citations so that users can see the legal text associated with each element of the bills that we tracked. And the result was the creation of 6 legal data sets tracking legislation addressing public health authority. And then our team at the center separately created another data set tracking enacted laws that limit public health authority. And for that, the researchers used Westlaw and openstates.org to identify relevant laws, which they then coded in the Monocle software. These are the 6 dataset topics that we created with our partners. Limits on public health emergency authority. This mostly relates to limits on a governor or state or local health official with regard to emergency orders. There's also the reallocation of public health authority. So for example, shifting authority from a state health official to the governor or to the legislature. We also tracked state limits on enforcement of federal law, public health preemption, regulation of specific public health emergency measures, and laws expanding public health authority. This slide shows the homepage where you can access these data sets on lawatlas.org. And there's also a QR code at the end of this presentation that you can scan to get to this site. So now I'll talk briefly about some of the results of our tracking. Again, this is state legislation introduced from January 1st, 2021 through May 20th, 2022. During that time frame, there were 1,531 bills introduced that touched on one or more of the topics that I just mentioned. 191 of these bills were enacted into law in 43 states and DC. This table shows the breakdown of how many bills were introduced for each topic, along with how many of those bills were enacted. The most common type of bill introduced were those that regulated a specific emergency measure, such as vaccine, masks, testing, and others. Note that many of these bills addressed multiple topics, so the totals reported by category will not necessarily sum to the total number of bills. And if you visit the data set for each of these topics on lawatlas.org, you'll find interactive maps and tables containing the state level details about the legislation, including the text of the bills. This chart shows the states that enacted a bill limiting the emergency authority of a governor, state health official, or local health official. Along the x-axis at the bottom, you can see the type of limit along with the number of states that enacted such a limit. The types of limits that we captured were restrictions on the scope of an emergency order. So that would be a limit, for example, on what the order could regulate. We captured restrictions on the issuance of an order, limits on the duration of an emergency order. So for example, stating that an emergency order could only be effective for 30 days. We also tracked laws that explicitly allowed the legislature to terminate an emergency order or a state of emergency. Some laws allowed for termination by another entity other than the legislature. And then Kansas was the only state to limit the governor's orders by allowing local governments to supersede them with less strict rules. So the most common of these laws were the limits on the scope of an order. One example of this is an Idaho law that limited emergency authority to measures that were essential to protect life or property from the occurrence of imminent threat of the disaster emergency threatening the safety of persons or property. And the vertical bars on this chart indicate whose authority was limited, either the governor, the state health official, and or the local health official. This chart shows the states that enacted laws either expanding, restricting, or preempting a specific public health measure. So along the x-axis at the bottom, you can see the type of measure along with the number of states that enacted a law related to that. The types of measures we captured were those that related to vaccination, testing, masks, school mandates, business measures, and places of worship. So the vertical bars here indicate whether use of that measure was expanded, limited, or preempted. And vaccine measures were the most commonly addressed of these. Just a note about which party controlled the legislature and any association to the legislative activity. There was little partisan difference in the intensity of the legislative activity, but there was actually quite a difference in the outcome of the activity. So the 15 states that introduced the most bills were fairly evenly divided between Republican and Democratic control of the legislature and governorship. But as this chart shows, all of the states that enacted more than one restrictive public health measure bill had Republican control of the legislature, except for Connecticut. I want to wrap up by sharing a few of the conclusions from our research. In the US, states have the primary responsibility for enacting pandemic control measures. So state laws that set the scope and limits of emergency authority are crucial to an effective public health response. These laws have been changing in ways that threaten to reduce state and local capacity to respond to emergencies. And tracking changes in health law infrastructure is really important for evaluating changes in health authority and ensuring that stakeholders recognize these changes. And finally, I'd like to note that we have been continuing to track these laws, and the general trends discussed in our paper continued through the end of the 2022 legislative session. We encourage you to check out our work. You can use the QR code on the left to take you to the homepage for the legal data sets discussed in the paper. And the QR code on the right will take you to the article on the AJPH website. Here's my contact information. Should you have any questions, please feel free to reach out. Thank you very much.